now I'm just going to. Thanks for joining, everyone. We're letting folks in and we'll get started shortly. Again, for those of you just coming in, we're going to give folks a minute to join and we'll get started just a couple minutes after the hour. Thanks so much for joining us. We're going to wait one more minute as everybody enters, and then we'll get started. Okay, thanks everyone for joining us. So happy to have you all here today as we start our fourth webinar in our Cities, the Future of Health series. We are looking forward to discussing our vision for the future of public health with you, while at the same time sharing real-world experiences from our members. As Walker said in the chat, we'll make sure to make the slides and recording available after the webinar. I'm Chrissie Juliano, Executive Director of the Big Cities Health Coalition. Our guest speaker today is Edward Johnson, the Assistant Health Commissioner for External Affairs at Columbus Public Health. In this role, he's responsible for public health policy, addiction services and environmental health divisions, and the Center for Public Health Innovation. He has more than a decade of experience in public policy and public health, including at the Columbus City Council and Ohio's House of Representatives. So in a little bit, Edward is going to talk to us today about what he and his colleagues learned in their successful push to restrict flavored tobacco sales in the city of Columbus. We're going to start with just sort of setting up some context around and part of the larger story about health equity and the future of public health. So really briefly, for those of you who don't know, BCHC is a forum for big city health department leaders to share best practices. We strategize together on how best to address complex urban health challenges and advocate for urban health, health equity, and the public health field as a whole. And on this map, you can see our 35 members from across the country. In this webinar series, we tease apart some of the core ideas in our urban health agenda and show how these ideas can be put into practice. We'll discuss a few of the key concepts today, but you can see more information on our website using, you can either use the QR code or go to our website and follow to the Urban Health Agenda link. So in our vision, health is more than healthcare, and also what most people consider traditional health issues. And really, the agenda lays out that all government agencies and relative community-based organizations must work together across sectors to promote and protect health and safety. Public health departments can and often should sit at the center of decision-making processes about community health. However, while health departments play an important role in protecting and promoting the health of their communities, no single entity alone can improve the health of the population. To be successful, these efforts require collaboration across all local government agencies and with elected and appointed officials and community-based organizations. Our urban health agenda rests on the premise that we must also dismantle structural barriers and systems that are built on generations of racism. Inequities are baked into too many of our institutions, laws, and policies. This means we must change more than programming in our communities. We've got to dig deeper and change inequitable structures and practices. In other words, we must work with communities, especially those that have experienced the most discrimination and have the least healthy outcomes, to determine together what will create lasting health and resiliency. We also need to advocate to dismantle systemic barriers so that everyone in our communities, regardless of where they live, work, or play, or their race and ethnicity, can live their healthiest life. So with that, we're going to hear a little bit more about what Columbus did around tobacco flavor restrictions, which really sits, I think, at this sweet spot that we're talking about. So I'm going to turn it over to Edward. I do want to note that we'll do questions at the end, but feel free to drop questions in the Q&A box so that we, as they come up, so you don't forget them, and so we can have them all queued up at the end. So with that, Edward, I'll turn it over to you.
Thank you, Chrissy, and thank you for that wonderful introduction. And so it looks like about the 82 folks on the call. Thank you for joining us. On behalf of Dr. Roberts, our health commissioner, and the over 500 public health professionals at Columbus Public Health, I'm really pleased to be here with you to talk about our journey and our path in passing, being the first non-coastal city to pass a really comprehensive flavored tobacco ban. So I don't want to take anything for granted. So the first thing that I do want to say is welcome to Columbus. We have a population of just over 906,000. We're the 14th largest city in the United States of America. Demographically, about 57% white, 29% African American or Black, and 7% Hispanic, Latino, and just about 6% Asian. Geographically, we are a very large and expansive city covering 226 square miles. I believe our sisters and brothers in San Francisco have pretty close to the same population in about 50 square miles, just to give some perspective there. Our median age is 31.2 years of age compared to our state, which is 39.5. So we're a very young city. We're a growing city. From census to census, Columbus has never lost population. Currently, we add about 30 people a day to our population, and that's not just being driven by internal migration, from the state or from the nation, or even immigration from abroad. We have a lot of Black and brown babies being born every day in Columbus, Ohio, and that is really the driver of our population growth locally. And so that really does inform a lot of the policies that we need to enact or choose to explore as a city and as a health department. So as we say that, let's talk about the health of our city. In Columbus in 2019, more than a quarter of our population smoked. That is an enormous number of tobacco users locally. We saw the per capita amount of smokers go up from 2017 to 2019, and it wasn't finalized at the time. These are the slides that we presented to our city council, but we knew during the pandemic that tobacco use went up, even from that 185 smokers per 100,000 number in 2019. So we knew that tobacco use was very high and that it was growing in our city. And that was something that deeply, deeply, deeply concerned us as the health department. So when we look at the health and economic toll, even statewide, 1 in 3 Ohio high school students used e-cigarettes driven by flavored varieties. And tobacco use here in Ohio and even in Columbus is the #1 preventable cause of premature death and disease, killing over 20,000 Ohioans every year. Here in Columbus, as a health department, we look at the leading causes of death to inform really what we should be doing. These are our leading causes of death here in Columbus for individuals over the age of 15. And we knew that 4 out of 5 were exacerbated by tobacco usage: heart disease, all cancers, chronic lower respiratory disease, and cerebrovascular disease. 4 of our 5 leading causes, when you smoke, those things get worse. So we knew that we had to do something about what that common thread was between those 4 leading causes of death. So why go after flavored tobacco products? On February 14th, 2020, our mayor, Andrew J. Ginther, declared racism a public health crisis. He knew that there were disparate impacts and disparate outcomes that were leading to a shorter lifespan for racial and ethnic minorities and a lower quality of life. We saw banning mint and menthol flavored tobacco products as a matter of health equity in our city, because market data showed us that that was the product most commonly being used amongst African Americans and other racial and ethnic minority populations. We also knew, because Columbus Public Health is responsible for tobacco control within city limits, that we have 804 licensed tobacco retailers. In order to sell tobacco in the city of Columbus, you have to have a tobacco retail license from Columbus Public Health. I apologize, I should have put this map in this presentation, but unfortunately, when you contrast where each of those 804 tobacco retailers are, it sadly, unfortunately, and tragically hews to the heat map of where racial and ethnic minorities live in our community. The best example I can give you is we have a highway that goes north to south called I-71. On the east side of it is a predominantly African-American neighborhood, and on the west side of it is a predominantly white neighborhood. All of the tobacco retailers in that corridor were on the east side of the highway, in the Black neighborhoods, not in the white neighborhood. And so we knew that we were watching a disparity, and we were licensing a disparity to occur in our community. So a flavored tobacco ban supported our efforts to address health disparity. And I want to make sure that I emphasize this because I will come to it later on. We focused on health disparity when we were doing tobacco control and not necessarily youth usage or youth prevention for this particular effort. So how did we do this, and how do we mobilize our community? Or excuse me, first, let me continue setting the table. Columbus Public Health does have a history of leading tobacco control in the 21st century in our community. In the early 2000s, Columbus passed an indoor clean air ordinance saying you can't smoke indoors, let's not do this in bars, let's not do this in restaurants. It took a constitutional amendment in Ohio for Ohio to have indoor clean air. So it bypassed our General Assembly, and the voters of Ohio put it in our Constitution that we don't want to smoke indoors, and we don't want to be victims of that. In the mid-teens, Columbus Public Health helped lead the effort to have Tobacco 21, to raise the purchase age for tobacco in the city of Columbus. And 4 years later, the governor put that in his state budget to have Tobacco 21 be the law of the state. So once again, you see, this was not a policy that passed statewide on its own merits. It was put in a budget bill that had many moving pieces and billions of dollars attached to it. But it was something our governor was passionate about and really wanted. So he used that as a negotiating piece to get other things through as well. And then lastly, we see here in the early 20s, Columbus Public Health pushing flavored tobacco. We'll see what the future of that is statewide here in Ohio, but we do hope that it eventually does go statewide. So to that end, how do we get there? How did we get here with flavored tobacco? Because I think we did this in a very different way than clean indoor air or Tobacco 21. We were part of something called the Coalition to End Tobacco Targeting. This was a coalition of over 130 health, education, community, and faith-based organizations. We had about 90 churches. We went to a great number of affinity groups, from the Columbus Urban League to the NAACP, to our Somali community organization, to our Bhutanese Nepali groups, to our Islamic faith groups as well. We went to anybody and everyone that we thought would have an interest in the health of our community. And we said, this is something we are considering. This is something that we want to put forward to our city council. What gives you heartache about this? Where are your concerns? And how can we bring you on board? We thought that this was really important because we saw in other cities right here in the Midwestern United States that if you didn't talk to people ahead of time, you left them on the chessboard, and there were opportunities for other entities to come in and neutralize their voice or to sideline them. So we wanted to make sure we were talking to people and at least putting our case to them first. We did this because we presented a case that for decades and decades, there's a history of predatory marketing of menthol flavored cigarettes to the African American community. We laid out what happened in Project Scum to target the LGBT community to get them hooked on flavored tobacco, especially menthol products, and then other minority populations. And this push by the tobacco industry to create new groups of users that are hooked on this addictive product. We identified a local campaign manager and community leader with authentic community connections and credibility to help lead and galvanize this group. Columbus Public Health, I would like to say, was a critical part of this, but I'm not going to say that we were the ones right there in front carrying the banner saying we have to have this in our community, because there was a recognition that if the community isn't leading this, it becomes more tenuous for us to accomplish this goal and have this legislation get passed. And so we also identified organizers for specific demographics throughout our community, faith-based youth outreach. I apologize, that should be a different bullet point. African-American organizations, LGBT community, and all of our new American groups were all represented in the coalition to end tobacco targeting. So as we got there and we got through this process, there were a lot of challenges that we were presented with in getting legislation passed. As I'm sure you all know, you will have multinational corporations cooperating and rallying small businesses in opposition to tobacco control. We were asked by our city council members, well, what's your response to this? And we pointed out the history that we had from indoor smoke-free and from Tobacco 21. I don't know if other cities had this experience, but when we did indoor smoke-free, we pulled the testimony and we pulled the clips when that legislation was going through. And the business case was that if you don't allow smoking sections in restaurants and bars and bowling alleys, they'll leave your city. Columbus at that time had a population of 700,000, and we were told you'll lose all your restaurants, you'll lose all your bars, all the bowling alleys will close, and everything will be around the city and not in the city, and you'll become a wasteland. And that didn't happen. Our population grew by another 200,000 in the following 20 years. We have more restaurant registrations than we did in 2000. And we have more bars, restaurants, and bowling alleys have never been more successful because families came in once they saw that these spaces were safer for them to be there because there was no smoking. When we did Tobacco 21, we were told by gas stations and convenience stores that they would be at a competitive disadvantage relative to their competitors in suburban jurisdictions that didn't have this legislation. So as a big expansive city, and for better and for worse, a car city here in Columbus, if every gas station closed in town, that'd be a huge problem for us. When we passed Tobacco 21, they didn't close, they didn't jump across the border, and that doomsday didn't come. That same argument was used with flavored tobacco, and so we said, here's the clips from the last 2 times we did major tobacco control. As a responsible policymaker, ask these businesses why it didn't happen last time and why it might not happen this time. So that was a challenge that we were presented with. It was a very loud challenge and it was a very forceful one, but we thought it was important to point out that that argument had been used before. The next challenge we had was you're targeting African Americans. This is a product that they want to use, particularly mint and menthol varieties. You're taking away something that they want. We used the chronic disease data that I presented with our leading causes of death, but we also presented COVID-19 infection data. Here in Columbus, the rate of infections tracked exactly to population demographics. I said we were 57% white, about 58% of our cases were in the white community. We're 29% African American, about 28% of our cases were in African Americans, and so on and so forth. But it was when we got to hospitalizations that we saw that health disparity become real. African Americans in Columbus are 29% of the population, but we're 40% of the hospitalizations due to COVID-19. It doesn't take a genius, doesn't take a public health professional, doesn't take a doctor to necessarily say, lighting your lungs on fire with mint flavored tobacco during a lower respiratory pandemic probably isn't the best idea. And may contribute to hospitalizations and other underlying conditions due to COVID-19. So we said, there's the underlying health disparity that made COVID worse for Black folks in this city. Beyond that, we had other challenges. We had elected officials who were personal users of tobacco. Not only that, they were African-American menthol users. The story that I usually tell is, this is no secret anymore, but we never addressed it until he did. Our council president was a menthol cigarette smoker throughout this entire legislative process. And very much to his credit, he never said, I don't want this legislation because it affects a product that I love. He informed it very rationally. He informed it very presciently. He said, I can't support this if all you do is take away something from people who are addicted to a product. You have to give them something. You have to start building ladders out of this addiction. I will only support this if we have a $1 million smoking cessation campaign in Columbus to help people get off of tobacco. And so he brought together a partnership of private sector partners and the public sector, each contributing $500,000 to have a smoking cessation campaign throughout this year to tell folks, one, that there's a flavored tobacco ban coming, but two, here's how you stop smoking or stop using these products before that ban goes into place. So that was really amazing, and that's how we helped overcome that. Was we will take something, but we will give something to our community as well. And lastly, the major challenge was, you introduce a piece of legislation, everyone wants to carve out an exemption for what they do or for what the loudest voices that they're hearing. We heard from vape-only stores that they're a smoking cessation product and really they're only for adults, so they should have an exemption, and that they were better than traditional retailers or retailers of traditional tobacco products. We shared compliance data to say that actually they had a 1% worse compliance rate than other retailers. And so there wasn't a difference there in terms of violating tobacco 21 laws from vape-only stores that we saw. We saw case studies from other cities. What if they are adult-only retailers, so they don't allow anyone under the age of 21? We were able to point out through case studies that it didn't solve for the problem of straw purchasers. And lastly, we knew that there would be a cultural discussion over the role of hookah and shisha amongst our new American population. We shared with our council, we have about 8 hookah lounges that are licensed in the city of Columbus. Eventually, I will be candid with you, there was an exemption for on-site consumption of hookah in these lounges. However, our council was very clear that because they had an exemption, that they would be subject to enhanced enforcement, which we will get to at a later slide here. So our role as the local health department, we conducted research. We participated in 9 public hearings that were held around the city about this issue with the community, with school-age parents of school-age children and children, and with others, with the health community as well. We provided testimony when requested. We did outreach and engagement with community members so that they could understand where we stood. We revised our health code to ensure enhanced compliance and enforcement of tobacco regulations. And then we changed our compliance structure. Prior to this process, we were doing 400 checks per year. We now are doing 1,600 checks per year for our 800 licensees. And so if you violate a check, that also triggers another compliance check. So we have told our community, this is of a great interest to us. So what did we do, I guess, is really the question that you might all be asking yourself. Our city council passed an ordinance 3253-2022. They created a lot of definitions to help us define what it is we were banning. They exempted the retail sale of flavored shisha tobacco in these lounges. They banned the sale, and they gave a 1-year grace period, so effective January 1st, 2024, for these businesses to get these flavored products off of their shelves and to stop purchasing it and ordering it, to give them time to clear their stock. As the Board of Health, they increased our tobacco retail license from $150 to $350. As I said, there are 800 retailers, over 800 retailers in Columbus. That's one retailer for nearly every 1,100 residents of our city. Everyone agreed that that was too many, that we needed to start making it a little more difficult to get the retail license. We were also asked to change our fine and penalty structure. Originally, it was $500 for your first offense and $1,000 for your second and every subsequent offense thereafter. We changed that to what you see on the screen now. Your first offense is a $1,000 fine. Your second offense is a $5,000 fine, and your third offense is a $10,000 fine and a loss of your license for 2 years. We call that the 3 strikes and you're out system. What we have found is that it's not about the money. Our business community told us our original fine structure was insufficient to motivate them to change their behavior and do more checks of IDs at the point of sale. $500 fine and $1,000 fine was the cost of doing business to them. That was said in a public hearing. We changed that to say, yes, the fines are more punitive in nature. But what we found almost immediately from the new penalty structure was the strikes were the most poignant thing that a retailer listened to. The very first strike that we issued as a department, the retailer came in and said, I'll pay the $1,000. I did it. I sold to an under 21. I apologize. I shouldn't have done it. Can this just not count as a strike against our license? So that's not how this works. So I will be candid. If you seek to go to the 3 strikes and you're out system, your appeal process will increase. You will see more appeals because they now know they have to make sure that they are tight and that they fight everything, or they will lose their ability to operate in your jurisdiction. So where have we been? Where are we going? This has not been an easy process. For about 9 months, up until December 12th, we worked with our council. We got a 7-0 vote, which sounds great, but when we started this process, we had 2 yeses, I would say 3 or 4 maybes, and a couple of no's. Through continuous government relations with our policy team, which we have a policy team of about 7 folks here at Columbus Public Health, we were talking to our council members, we were addressing their concerns, and we wanted to offer them an explanation to any question that they had. So we got from 2 for sure yeses to a unanimous vote with 7 floor speeches in favor of this action. The next day, the Ohio Senate amended a bill to preempt the ordinance that we had passed, and 3 days later, at 4:03 a.m., that is not a typo, after a 19-hour marathon lame duck session, the Ohio General Assembly passed this preemption to our local flavored tobacco ban and sent it to the governor. As you see there, the governor waited till after the first of the year when that lame duck General Assembly could no longer sit and potentially override his veto to veto that bill. Fast forward 6 months and 10 days, the Ohio Senate once again amended the state budget bill to preempt local action, and they passed that legislation. It was written in a peculiar way that the governor thought that it might ban certain types of flavored tobacco, but upon reading it, you began to learn that it really didn't ban very many flavored tobaccos, if any, at all. On June 30th, the conference committee between the Ohio House and the Ohio Senate passed the budget and sent it to the governor's desk with preemption. And on July 4th, Governor DeWine line item vetoed that preemption from the state budget, thankfully. So we sit here on September 12th, anxiously waiting for January 1st to come so that we can start implementing and enforcing the flavored tobacco ban here in Columbus. I will tell you, my policy team is watching the General Assembly as this is their first day back from their summer recess. We are still guarding against preemption. We are still engaging in what I like to call the dark arts of government relations. We want to make sure that if something happens that we're part of the conversation. And it really is, it's not about policy or research. It is about government relations and the relationships that we have at the State House. So our policy team does really great work. We kind of divide by portfolio and subject area, but between myself and the section chief for our policy team, he and I divide the relationships. I will handle local government. So you see city council there. He will handle state government. So all of those wonderful Ohio Senate and governor lines there, he's responsible for, and then I'll handle federal if that's ever a need in this space. So that's where we currently sit. Hopefully you were able to take some learnings. Chrissie, hopefully I haven't embarrassed you and I've done the right things and said the right things here. But thank you all very much for your time. If there's any questions, I will do my best to answer them.
Thanks so much, Edward. As I suggested, you did not embarrass us at all. It was really great. We have some questions. I could ask you numerous questions for the next 20 minutes. Let me try and sort of bucket a couple of the themes in the questions. And a lot of this you touched on, but I think there's some interest in hearing a little bit more detail on some of it. So we have a couple of questions about how you worked with the community, and is there a specific question about how you navigated flavor restrictions and hookah among conversations with the Somali community? So maybe you could talk a little bit about, you shared you had this big coalition, you did a lot of that sort of, in some ways, retail politics with community-based organizations, but can you add a little bit more flavor, no pun intended, to what that work looked like?
Absolutely. So as we said, the Somali Community Association of Ohio was part of our coalition, very proud member. One of the benefits that I will say we have here in Columbus, so I recognize not everyone has it, is one of the more prominent imams in the Somali community is actually a scientist by training. I believe he has a master's degree in biology. So for him, he kind of knew, and he said, listen, there's no religious reason for hookah to exist. Now, we also recognize that there would be a community outcry. And like I said, we intentionally went through our tobacco retail licenses. We identified, I believe, 8 hookah lounges in town. And so I don't want to quite say it was a deal, but what we said was, we understand that there might be appetite at City Council, and there was, to create an exemption for these hookah lounges for on-site flavored tobacco consumption. We said, that's fine. Every retailer receives 2 visits, 2 compliance checks per year. Because you have the privilege to sell flavored tobacco in the city of Columbus, you will receive 4 compliance checks per year. We want to make sure that these 8 establishments are not misbehaving, are not taking advantage of the fact that they receive this exemption, and are being responsible members of our community. That seemed to be a fair bargain, and we hope that those partners remain in good standing with us on their tobacco licenses. I do not believe they have received any strikes thus far for under 21 sales, which is a very good thing. And so as we move forward into flavored tobacco restrictions next year, we hope that they remain a good partner.
And, you showed us the timeline of the legislation and the pieces. How far out did you start all this community engagement? How long did that process take?
That's a great question. That timeline probably could have been 2 or 3 slides by itself. So the legislation passed on December 12th. We probably started this work in January of 2022. We started having those conversations, but the process that we wanted to engage in, and that I was very clear with all of our partners at Tobacco Free Kids, at the Heart Association, Cancer Association, Lung Association, a lot of people wanted to see an ordinance. They wanted to see a draft, and they wanted to react to it. And I said, that's not the phase that we're at. If the community is going to reject the idea, my policy team and myself, we do not need to waste time drafting an ordinance. I said, we need to have listening sessions, and we need to be good community members sitting down with them when they want us to, when they're ready for us to come in to say, we're thinking about this. How do you feel about it? So I would say we started that outreach in January of 2022. We probably didn't even have a draft available for folks to take a look at until September or even October of 2022, and it passed in December of 2022. So I had to make sure folks knew the legislative process was not the most important part of this. It was the community engagement process.
And how did you, I know you talked about sort of the disparities in health outcomes and tobacco use and things like that. Did you work through existing partnerships with community organizations? Did you build new ones? I'm sure it was a little bit of both, but we have some questions about sort of what that process looked like and reaching those harder to reach populations and those that were more at risk.
Absolutely. So for us at Columbus Public Health, we wanted to take every learning that we possibly could from the COVID-19 pandemic, from vaccine outreach, and take advantage of the relationships that we had built that we had never had in the health department before. Some of the things that we learned was we now have standing contracts, community health with community-based organizations to encourage health promotion and health messaging with, I believe, about 8 community-based organizations. So this is the Columbus Urban League, this is the Somali Community Association, this is the Bhutanese Nepali Association. This is a number of groups that hit those hard to reach groups where we always say, if something bad's going to happen, it's going to hit you twice as hard. So we want to make sure that that pipeline is up and established. It was there for COVID, it was there for flavored tobacco. Now it's there for housing concerns that are coming to the fore, safe and healthy housing concerns. It's there for any number of issues, and we maintain that pipeline through those contracts, those community-based contracts.
Thank you. So a couple of really specific questions. The fines, where does the money go when you levy those fines?
So that money goes into the Tobacco Education and Prevention Fund. And so it does help us fund our program for control and enforcement. So the way that we do that, we do send individuals under the age of 21 into establishments with money from that fund to make an attempt to purchase tobacco from a retailer. That funds that program. And so one of the things that I've told the business community is, if you don't like how big our program is, all you have to do is stop violating, and the fund stops growing.
And then what about potential lawsuits from industry? I know, in some jurisdictions, that's part of the conversation about whether or not, they will move forward on this. And it's a major barrier for policy change.
Absolutely. I think our partners in California probably have a lot of experience with this, with recent constitutional amendments that they've passed. That's one of the places that we've looked to say, we feel confident. Now, obviously, we have a city attorney here in Columbus that feels very confident and very assured that if we have to go to court, he and his staff stand ready to defend everything that we've done. And they helped us with the draft of the ordinance that we've done. It helps to have your legal counsel on your side and saying, we think that this is a good thing to do. So we do feel confident in that matter.
And then what are your thoughts around if this will cause an increase in illegal activity in the tobacco black market, and what you guys are planning to do to sort of counteract that?
So for us, I don't think there's so much a concern about a black market emerging around these products. Additionally, for us here in Ohio, I do have a very strong feeling that Columbus leads on tobacco control policies, and the state does end up catching up to us. So yes, I understand kind of the economic arbitrage point that is made, that, well, if you have suburban partners who don't do this, what's to just stop me from going across city limits? And my response is, your access and means to transportation is the only thing that stops you. But I do believe the state comes along with us. This is the direction that I believe the country is moving. I don't think that we will see that emerge. We were told some of those arguments could happen around Tobacco 21. We don't feel like that has happened here. So it's not something that we've experienced, but we do have our partners at Public Safety and the City Attorney's Office who've created a civil framework to address the illegal sale of tobacco, not just the non-permitted sale of tobacco.
And then we have a question. You talked about how important it was getting your city council and your mayor on board. Can you talk to us a little bit more about that really critical role that your policymakers and elected officials play, and how you really worked with them to get their support and to express their support for it publicly?
Absolutely. So I could tell you all the statistics, all the data, all the reasons that we should do something. And I think pre-pandemic, us being in local public health, we know that wasn't always the most persuasive argument. That wasn't what always got us over the finish line. I cannot emphasize this enough. When you engage in policy work, when you engage with elected officials, the most important thing you walk into a room with is your relationship with that individual. I'm not saying you have to be their best friend or you have to be chummy, although that doesn't hurt. But do you have a positive relationship? How have you built and maintained those relationships through the pandemic. I know that in some ways, not in every way, but in some ways, Columbus Public Health and public health as a department and executive agency of the city was slightly an afterthought. That's the health folks. They're doing their thing over there. They have a board. What do we need from them? What do we need of them? Through COVID, I think that we built our reputation. People knew who we were and what we stood for, and they knew that when we came into the room, we had the best of intentions, and we still do. And that's a relationship and a reputation that we wouldn't sacrifice for anything. You know that we're a science-based organization, but we also know that our council members will take our call when we do call them. And so I try to tell my policy team, I try to tell folks who engage in this work, you're not doing policy work, you're doing government relations. And the important part of that term is relations. Do you have a relationship? Because you can walk in and scream at any elected official you want, and that just makes you dime a dozen to everyone who walks through their door.
Awesome. Thanks so much, Edward. There's so much information in here. We look forward to sharing out the recording and the slides. So thank you again for your time. Thanks everyone for joining us. We do want to also thank our funding partners for their ongoing support of not only the Urban Health Agenda, but BCHC more broadly. And I think the last slide here shows how you can get in touch with us via our newsletter. And we have fancy QR codes, things like that. So please do be in touch if you are looking for more information. And again, our newsletter is where you find out about all this interesting stuff. So thank you, everyone. Have a great rest of your day.